All right, hello. My name is Dr. Olivier Wenker. I'm originally from Switzerland and I have been here in Houston, Texas for the last 21 years. And what I want to tell you today is introduce a brand new device that we're just launching in the United States. This, by the way, will be completely pain-free. Okay? This part of the thing you're not going to feel at all. All you're going to feel is a little cold jelly on the belly, right? That's what we're going to do. So all we need to do at this point is to distribute that jelly a little bit and then just go very, very slowly move that. So let me explain what we're doing right now. The fat cell is like a small room, and in the small room we have a big tree. The tree has a lot of branches. Fat is stored as fatty acid branches. So it's like a tree, literally a tree with long branches. That's what the fat looks like in your fat cell, right? So ultrasound is a sound wave. Let's say you have an explosion outside of your house or a train passes by. Your window will start to shatter like that. It will start to vibrate. That's the sound. That's the sound that pushes the sound wave. If we put sound waves into the body, we push and vibrate the cells. If I take back the information, I can create an image. That's how you get your baby ultrasound done or your medical ultrasound for whatever purpose. In this case, we really don't care about the image, especially because we only use an ultrasound that will penetrate about 1.5 centimeters. All we care about is to vibrate the fat cell. So what happens, the wall of this room with the big tree, the wall of the fat cell is fat by itself. It's a bilayer of fat, 2 layers of fat. So what we're doing now, it's like an earthquake. We're putting an earthquake down into that fat cell. We're shaking it like crazy. So what happens in the wall, we get some additional holes and windows and doors. What happens with the tree, like after a hurricane, you see all these branches broken off and the leaves are gone and all that. So this is what we're doing. We're taking these long fatty acid branches and we turn them into little free fatty acids, glycerol, however they're called scientifically. So what I need to do with the fat, I need to metabolize it. So many companies have become kind of smart, so they send their patients to the gym. However, you have to metabolize it probably within about 15-20 minutes. You need to start metabolizing because otherwise it's already going to get stored. That's happening pretty quickly, the storage of, even if you eat sugar, they're going to be turned into fat and store away. So if you keep on eating chocolates every day, you can gain substantial muscle, body mass because it's all turned into fat. So what we're doing once we're done with this, we're going to metabolize the fat right away by stimulating her muscles. Okay, good. So now we did the first part. She cleaned her belly from the jelly and now she's ready for the second part. So remember, for the last 20-30 minutes, however long we did that, we kind of dissolved fat and the fat is now swimming in her bloodstream. So these are sticky pads. They can be used multiple times. Okay, so these are brand new, so they're quite very sticky. And what will happen is we're going to have electricity come through here and they will distribute through the skin into the muscles. And whenever the muscle, when you touch like electricity, you contract. And same thing idea here. So we're going to contract the muscles. So on her, we're going to work a little bit with the abdominals. So the abdominals come from here and go down here. So what I'm going to do, I'm going to apply one pad here and the next pad just above it. Like this. Put this one away and to try to capture all those muscles here on the side. Now this is more important typically for guys because that's where the love handles are, right? But for women, you know, kind of you have a nice shape and you want to preserve it, but still sometimes it's too big, so you want to shrink that as well. So I'm going to lift here a little bit. In fact, I'm going to start a little bit on her butt. So let's assume she wants to lose a little bit weight here on this area. Oh, you say yes? Okay, you want that? Okay, so we're good. So what we're going to do, we're going to start, here the muscles are all coming like this or going like this, right? So what we're going to grab here is several muscle groups at the same time and they will start contracting like this. Okay, so I'm going to do one here and about one here. So here, very easy, I'm going to start putting some energy into it by just turning this button. And you tell me when you start feeling. Okay, she got the tingling, and that's good. So the idea is that it works a lot, but you're not pain. Was that pain?
It's just
no. Good, okay. So now I'm doing the other side, and I know I can go pretty quickly because it's symmetrical, right? So is it about the same? Like the other side or more? Yeah?
Yes.
Okay, good. So now I'm going to move on to these two. At this point, what's happening is every minute of the next 30 minutes or however long the treatment will be, there will be a different pattern of excitement for the muscles. So sometimes you're going to feel like, look, I already see your muscle going here, like, oh, nice. You know, they go like this, right? So the next time you feel more here, then you feel like more vibration, then you feel more contraction. Every minute something is changing. We have 150,000 different patterns programmed into this machine. This is the Rolls Royce of any muscle stimulation. There is no better machine out there that does that. It's the most advanced. Why? Because all the programs were developed by the people who wrote the book on muscle stimulation, the specialists on that. So if you go and read about that and you want to write books, those people who write those books design our chips, okay, our software. All right, how did we design that? Well, we went to the gym. We put some needles into muscles, I mean, very cruel kind of with athletes, and we started measuring how quickly the muscle contracts, how it kind of contracts, what shape it takes, the speed of contraction, the strength of contraction. All these things we measured and we put into the machine. So depending on what muscle you excited or you used, in what shape or form, whether it was running or more kind of doing something else with your leg muscles, they all have different patterns. So we took all those and we stimulated them here. So what we're doing right now with you, we're doing a very efficient workout. You have to understand, when you go to the gym, you're going to be activating probably about 55% of your muscle fibers. If you're a very well-trained athlete that is training every day for 2-3 hours, you might activate maybe 60-65% of your muscle fibers, but we will never activate 100% of your muscle fibers. When do you activate 100% of your muscle fibers or close to it? When you have the lion running behind you trying to eat you. You have an extra energy and strength that you can develop in emergencies. And that's where you activate way more muscle fibers, right? But just regular movement, you're not going to activate much more than 55-60% of your muscle fibers. However, the machine doesn't care about that. The machine will excite and activate all the muscle fibers that are between those pads. So we're going to get basically 100% muscle activation. And not only in compared to exercise where you activate one muscle group after the other, depending on what you do, we do it all at the same time, right? It feels like you're, woo, right? Like a sponge, we're squeezing you, right? Pain-free. We don't have any limitation on size. A lot of devices will not work when you're really big because we need to apply some clamps, whatever. These pads will go on any size, small or big. So we have no size limitation. It's pain-free. We can do multiple areas. Most devices will only do one area. We do 10 different areas at the same time. Right? So it's very, FuturaPro, absolutely a unique device, new to the US.